Hi, I'm Dr. Scholz. The subject of vitamin D comes up frequently when talking about prostate cancer. Why is that? Well, probably because men with prostate cancer are often treated with hormonal therapy, which causes accelerated calcium loss from the bones. And that needs to be counteracted. Adequate vitamin D levels helps improve the absorption of calcium from the intestine into the bloodstream. So everyone who is getting hormonal therapy typically is advised to take some calcium at bedtime and some vitamin D. The subject of vitamin D metabolism and treatment is vast and very controversial. Some people claim it improves your immune system, it does all kinds of other magical things. I've seen this pattern over and over with all kinds of supplements where discoveries are made that they're necessary, and then the public tends to go overboard and believe that massive amounts are going to be useful. The problem with that thinking is that massive amounts of anything are almost never useful. And so the appropriate approach, at least with vitamin D, is to test the levels in the blood. And I don't know why that's not talked about more frequently. People talk about you should take 1,000 or 2,000 or 5,000 or 400, but it really is predicated on whether or not your levels are low. And it turns out that in the general population that I see, men in their 60s, 70s, and 80s, about 25% of men run low vitamin D levels, that is below 30. And low vitamin D is going to mess up calcium metabolism and can have other deleterious effects. So testing once a year should be an appropriate part of everyone's annual physical exam. If vitamin D levels are low, I would recommend starting with 1,000 to 2,000 units a day, and then retesting after about 3 or 4 months. It takes a while for new levels to equilibrate once the vitamin D has been started. You can't check it a week or two later. And then once normal levels are achieved, periodic rechecks are necessary to ensure that that is maintained, and also to make sure that the levels don't go too high. So in summary, vitamin D is a very appropriate thing for men with prostate cancer, especially those that are on hormonal therapy. But it starts by checking blood levels, not by picking some arbitrary amount of 1,000, 2,000, 5,000 units a day, because your levels may already be adequate, and getting too much vitamin D is a potentially negative thing that could lead to problems instead of becoming a solution.